Good morning, I'm Rosalie. Today we have resources to help you explore your options in medical care, pain management, and we'll offer healthy alternatives to improve your diet and your overall well-being when we return. If you're a veteran on Medicare, this is a very important time of year for you. It's time to make healthcare decisions to maximize your coverage by choosing a Medicare Advantage plan that will complement any Veterans Affairs benefits you may already have. The plans are designed with the needs of veterans in mind, so veterans have options to best suit their healthcare needs. Ed Sandrick is the Director of Veterans Channel for Humana. He joins us with helpful information for veterans to better understand a Medicare Advantage plan to help round out the coverage provided by VA benefits, as well as maximize health benefits to ensure the right health Medicare plans are all in place by January 1st. Good morning, Ed.
Good morning, Rosalie. How are you?
I'm fine, thank you. Ed, you served as an active duty infantry officer in the U.S. Marine Corps from 1970 to 1979 and retired from the Marine Corps Reserve in 2000, attaining the rank of colonel. Thank you so much for your service. Shall we refer to you as Colonel Sandrick?
I think Ed would be great.
Okay, Ed. If we look at the demographics today of our baby boomer population, more than 10 million baby boomers served in the military. That's some 40% of males of their generation. Veterans, as a group, are predominantly men with a median age of 67. What Medicare Advantage plans are designed with veterans in mind?
Well, there are many Medicare Advantage plan options out there, as I know you know, and it is important for anybody who's eligible for Medicare to study those options. There is a plan. Humana has the Humana Honor Medicare Advantage plan that was designed with veterans in mind, particularly veterans who use the VA healthcare system and get their prescription drugs through the VA. So it's a plan that caters to some needs that veterans have that they may not get. Robust dental plan and access to urgent care. And the Humana Honor Medicare Advantage plan is a zero premium plan. So the cost is nothing for enrolling in the plan. And a veteran can have both VA coverage and a Medicare, original Medicare or Medicare Advantage plan. They work side by side, don't conflict with one another. They essentially can complement one another.
If a veteran has Humana Honor Medicare Advantage plan, can they still get their prescriptions filled through the VA?
Absolutely. In fact, the Humana Honor Medicare Advantage plan was designed with that in mind. So it is not a Medicare Advantage plan with prescription drug, which is an option. There are Medicare Advantage plans that also have prescription drug benefits. This one in particular allows the veteran to continue to get his or her prescription drugs at the VA, use other services at the VA, but have the Medicare Advantage plan as an option external to the VA. And as I mentioned, the urgent care benefit and the dental coverage is something that would fill gaps that the veterans who use the VA may have.
So Ed, tell us where our viewers can find more information to find the right plan.
Yeah, especially this time of year. As you mentioned earlier, this is the time of year for Medicare individuals to look at their options for 2020. So we can go to Medicare.gov, which has a lot of information about all the plans available, or Humana.com/Medicare, where they can see the plans that Humana has to offer, as well as get access to a licensed agent to talk about plans, benefits, budgets, and healthcare needs.
All right, thank you, Ed, for joining us this morning to share Medicare Advantage plan information to benefit our baby boomer veterans.
Thank you, Rose.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great. No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry, so you can stay healthy and help keep those around you healthy. For more information, visit cdc.gov/hand washing.
It's the holiday season and a great time to shop for deals on gifts for family and friends. But don't forget about taking time to explore new healthcare plans that offer great values as well. If you're a senior who likes their doctor and prefers their network hospital, just in case their health declines, you have a short window of time that ends on December 7th. Here to help seniors learn more about new healthcare plans available to best address their needs and stay on budget is Dr. Christopher Arnold, the Senior Medical Director at WellMed. Good morning, Dr. Arnold.
Good morning. Thanks for having me.
Doctor, it's a busy time of the year for all of us, but for those approaching Medicare age or already on Medicare, it's also very important to set aside time to evaluate their present-day healthcare needs. What questions should seniors be seeking answers to?
Well, there's a couple of key questions that you want to ask your family member. The first one would be, are they happy with their current doctor? A lot of people do not realize you can change your doctors, whether it's this time of year or earlier in the year. Then I'd follow that question up with, does your doctor practice value-based care or outcomes-based care? A lot of people don't realize, but actually doctors are graded now based on how well they take care of a patient's health and how well they manage their chronic disease of, say, diabetes, high blood pressure, how well they give vaccinations or screen for cancer or care for chronic respiratory illnesses. And doctors are actually rewarded based on how well they keep their patients healthy based on national standards that are set throughout the nation.
Many families will be together during the holiday season. What do you suggest to open up dialogue on healthcare plan options to help a family member choose the right doctor?
Well, I think I'd first start by asking the doctor's clinic about what are their appointment times like. What is their average wait time? What is their next appointment availability? Do they have weekend hours? What kind of provider would take care of me if I was sick at night or weekends? These are all key questions that you can ask in addition to the value-based care question I mentioned earlier, or even around how do they coordinate with my specialist or other healthcare providers that are taking care of me? How can I access my labs? Those are all key questions to know whether I have Dr. Wright taking care of my health.
So value-based healthcare offers better healthcare outcomes.
There have been a couple of key studies that show this value-based care model is the way to go. There was a study that was done by the Harvard Medical School earlier this year that was released that showed patients under the care of a doctor with value-based care actually had better preventative care and better management of their diabetes. And then in another report released by a national health insurer in 2017, actually encompassed 15 million patients in a Medicare value-based practice, actually had 13% chance less likely to end up in the emergency room and an 8% chance less likely of being admitted to the hospital. Not everybody wants to talk about whether they've had their vaccine or screening for colon cancer or breast cancer, but those are key, or are they at a fall risk, or screening for things like nerve damage or depression or dementia, right? Those are all things we would rather uncover early in the disease so that we can prevent the, bad outcomes that can sometimes happen if those go unchecked and unmanaged. So that's the value of talking and seeing a doctor with value-based care.
And depression is a big issue for seniors due to drastic lifestyle changes that happen, right?
Yeah, there's a thing called social isolation, right? Where seniors, they maybe get a little uncomfortable. They have a mild dementia, so they just don't tend to want to interact with others or family members. So they become kind of reclusive. And when you get kind of this cabin fever type of situation, and then it can lead to, not going and preparing meals, not getting food, not doing the important things that seniors need to be doing, staying active, and it leads to worse and worse care and can be quite dangerous. So it's important to check up on our senior patients and family members quite often, make sure they're getting out.
Excellent. Doctor, tell us where our viewers can find more information to choose the doctor they want.
Sure. You can go to wellmedhealthcare.com/Dr. Wright, or you can call our toll-free number 833-925-0422.
Thank you, Dr. Arnold, for sharing the benefits of value-based healthcare to enjoy a healthier life.
Thank you.
Did you know C-sections are the #1 surgery in the U.S.? Each year, 1.3 million pregnant women deliver their babies by C-section. There's been many advancements in women's health care, but not in childbirth and C-sections. Truth is, there's been a lack of major breakthroughs in pain management for women since 1980s, when the epidural became common, leaving us with opiates as the only choice to manage pain following a C-section. Fortunately, now there are effective non-opiate options to manage pain after C-section deliveries. Joining us this morning to highlight advances in opiate alternatives is Dr. Elizabeth Scherow, an expert in obstetrics and gynecology. Good morning, doctor.
Hi, Rosalie. Thanks for having me.
My pleasure. Childbirth is often the first time a woman is exposed to opiates or other pain medications. Tell us, what do expecting moms need to know about C-sections and what happens after surgery?
Thanks so much. I do think in my practice it's something we have a discussion with starting at 36 weeks. about pain control after surgery and what alternatives there are. Women, if they can have an opioid minimizing procedure, will absolutely, like you discussed, having, breastfeed better, be able to move about better, get up to the bathroom, less constipation, less side effect. The opioid isn't in their breast milk. It really is a better type of procedure.
Do the opiates infiltrate the breast milk? And how will that affect the infant?
Yeah, infants can absolutely be drowsy, have difficulty breastfeeding. So if we can minimize that, we try to. So in my practice, we use a long-acting numbing medication at the time of closure of the C-section. We actually put it right into the incision, just like you would in a dental procedure, have long-acting numbing medication. And so patients will also use Tylenol and Motrin for their pain control afterwards.
All right, doctor, tell us, how do you envision the new standard of care for women? What should we all aspire to?
Great question, Rosalie. Listen, we believe that at Axia Women's Health that women deserve more. They should have that conversation with their provider, discuss their different options, be able to have choices and advocate for themselves and be able to have an open opioid minimizing procedure.
In your practice, you regularly use non-opioid medications to help women. How does that effectively combat the pain?
It's been used, Exparel's been around for, since 2012. Over 6 million patients have used it. In my practice, it's standard to use for any C-section to use it at the time of closure, as I said. And we really try and encourage patients to take Motrin and Tylenol afterwards. I haven't prescribed an opioid in months. I no longer walk around the hospital with my prescription as it's not needed. And that discussion starts roughly at 36 weeks, but I encourage all women to talk to their patients about it.
Doctor, you have this conversation with your patients. You discuss pain management options, but some are concerned about managing their pain. What are some key benefits of utilizing non-opiates for moms-to-be? And how does that impact their recovery?
Well, they certainly can walk sooner. They, I mentioned constipation. They also usually can bond better with their newborn, their other child, be able to take care of that 3-year-old that's at home, or maybe that 3 and 5-year-old at home, able to take care of themselves better, and really feel like they're recovering on a better pathway.
And opiates can leave you with that edgy feeling that affects a mom's responsibilities, and that can upset other family members, right?
Yeah, I mean, think about it, feeling a little bit dizzy, maybe a little bit out of it, not being able to make decisions for yourself, and being groggy and tired when you're up all night taking care of a newborn. That additive opioid, if you could avoid altogether, imagine your recovery without that.
Doctor, are some patients more prone to get addicted from opiates than others?
I'd have to refer you elsewhere. I haven't studied that in detail. I would say to you that every woman has a pain score or a comfort level or discomfort level with surgery. I really encourage patients to go to csectionpain.com and download their guide and have that frank conversation with their patient.
Thank you, Dr. Giroux, for joining us this morning to share advances in pain management using opiate alternatives.
Thank you.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great. No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry, so you can stay healthy and help keep those around you healthy. For more information, visit cdc.gov/hand washing.
According to the Center for Disease Control and Prevention, nearly 30 million Americans have diabetes. Right here in Florida, 2.4 million people have diabetes, and 5.8 million adults have pre-diabetes. That's 38.7% of the adult population in Florida. People with diabetes have medical expenses that cost almost 2.5 times more than people who don't have diabetes. Here to create awareness of the risks of diabetes and encourage people to make healthy diet changes is Latina chef Leticia Morano Schwartz, healthy cuisine author of 3 cookbooks. Good morning, Leticia.
Good morning, Rosalie.
Leticia, you've been very busy working on a new cookbook entitled Touch of Sugar as a part of America's Diabetes Challenge program. Tell us about this work.
So let me tell you, A Touch of Sugar is actually the name of the documentary that I've been working. And type 2 diabetes is a very personal topic to me. My grandfather died from complications of the disease, and my grandmother really didn't have the right resources and the right information to help him cope with the disease. And as a chef and as a Latina, I understand some of the common challenges that Hispanics face across the nation, but also in Florida, like eating healthy, exercising, and working with your doctor on a treatment plan that's right for you. And just like you said, Rosalie, there is an alarming fact here. Almost 12% of the Hispanic population in the country is already diagnosed with type 2 diabetes. That's why I joined forces with Merck on this documentary called A Touch of Sugar, which really raises awareness about type 2 diabetes, especially among underserved communities.
Over 26% of the population of Florida is Hispanic, and type 2 diabetes is expected to affect more than 50% of Hispanic men and women in the U.S. over their lifetimes. Leticia, how are you addressing this significant concern among the Hispanic community?
Well, we hope that after watching the movie, people will realize that they're not alone in this journey. There's a lot of people going through the same issue. And what we hope to do is to bring people together to make fundamental changes to the way that we treat, support, and advocate for people living with type 2 diabetes. The goal of the movie is not only to raise awareness about type 2 diabetes, but to sparkle change in lifestyle, change in actions, and ultimately to help America confront this epidemic head on, one community and one patient at a time.
Leticia, like yourself, my grandmother and father passed away from the ravages of diabetes. My father had complications like vascular disease that caused amputations. So there's so much we don't know about the effects of diabetes. Can you help us learn more?
Absolutely, and diet is such an important part of managing type 2 diabetes because it can help you achieve your A1C goal. A1C is really a blood exam that doctors use to look at your sugar levels over a period of 2 to 3 months. And it's one of the key factors in managing type 2 diabetes. And again, as a chef, I come up with recipes that are great for the whole family. It's a fun activity. I really want to inspire through this movie and through my work people to come together in the kitchen and cook together, talk together, have fun in the kitchen. So I have recipes, like for example, a salad with smoked salmon and mango and arugula and Moroccan meatballs, that are great for the whole family to cook together. One of the worst things that you want to do when you have type 2 diabetes is isolate a member of the family.
Each year, about 105,000 people in Florida are diagnosed with diabetes. How can the American Diabetes Challenge help?
So we really want people to use this documentary as a tool. We want to arm people with information. We want to be the center for education about type 2 diabetes.
Where can our viewers find more information on America's Diabetes Challenge and A Touch of Sugar documentary?
We also want to say this, Rosalie, we want people to come to our website, A Touch of Sugar Film, and if they ask us to see the link, to see the documentary, we can give them the link to the movie, or even if people want to host screenings, for their communities, just ask us, get in touch with us, visiting atouchofsugarfilm.com.
Thank you, Leticia, for all of your delicious healthy cuisine tips and sharing your good work to help people with diabetes improve their healthy eating habits.
Thank you so much, Rosalie. It's a pleasure.
Take time to evaluate your options in health and wellness, as well as those family members and loved ones around you. Take a value-based responsibility step to caring for your health and wellness. Share with us how you benefit from being responsible for the value of your health and wellness at facebook.com/Rosalie Show, and follow us on Instagram at The Rosalie Show. Watch this episode and many others 24/7 at RosalieArcherShow.com. We want to thank you for joining us this morning, and we look forward to seeing you soon and hope you enjoy your holiday season.